Hey, Alpha Nurses, and Licensure from alphanursguide.com. This is 20 practice questions. With that the way, let's get started.
Question 1. A clear liquid diet has been prescribed for a client with gastroenteritis. Which item is appropriate to offer the client? 1. Soft custard. 2. Orange juice. 3. Clam chowder. 4. Fat-free beef broth. The correct answer is 4. Fat-free beef broth. Rationale: a clear liquid diet consists of foods that are relatively transparent. Soft custard and orange juice would be included in a full liquid diet because they are opaque, not clear. Clam chowder is opaque and also includes pieces of clams, thus eliminating it from a full liquid diet. Question 2. A client with heart disease is instructed regarding a low-fat diet. The nurse determines that the client understands the diet if the client states to avoid which food item? 1. Apples. 2. Cheese. 3. Oranges. 4. Skim milk. The correct answer is 2. Cheese. Rationale: fruits, vegetables, and skim milk contain minimal amounts of fat. Cheese is high in fat. Question 3. The nurse reinforces instructions to a client to increase the amount of riboflavin in the diet. The nurse should tell the client to select which food item that is high in riboflavin. 1. Milk. 2. Tomatoes. 3. Citrus fruits. 4. Green leafy vegetables. The correct answer is 1. Milk. Rationale: food sources of riboflavin include milk, lean meats, fish, and grains. Tomatoes and citrus fruits are high in vitamin C. Green leafy vegetables are high in folic acid. Question 4. A client with a burn injury is transferred to the nursing unit, and a regular diet has been prescribed. The nurse encourages the client to eat which dietary items to promote wound healing? 1. Veal, potatoes, gelatin, and orange juice. 2. Chicken breast, broccoli, strawberries, and milk. 3. Peanut butter and jelly sandwich, cantaloupe, and tea. 4. Spaghetti with tomato sauce, garlic bread, and ginger ale. The correct answer is 2. Chicken breast, broccoli, strawberries, and milk. Rationale: protein and vitamin C are necessary for wound healing. Poultry and milk are good sources of protein. Broccoli and strawberries are good sources of vitamin C. Peanut butter is a source of niacin. Gelatin and jelly have no nutrient value. Spaghetti is a complex carbohydrate. Question 5. The nurse has completed diet teaching for a client who has been prescribed a low-sodium diet to treat hypertension. The nurse determines that there is a need for further teaching when the client makes which statement? 1. This diet will help lower my blood pressure. 2. Fresh foods such as fruits and vegetables are high in sodium. 3. This diet is not a replacement for my antihypertensive medications. 4. The reason I need to lower my salt intake is to reduce fluid retention. The correct answer is 2. Fresh foods such as fruits and vegetables are high in sodium. Rationale: a low-sodium diet is used as an adjunct to antihypertensive medications for the treatment of hypertension. Sodium retains fluid, which leads to hypertension secondary to increased fluid volume. Fresh foods such as fruits and vegetables are low in sodium. Question 6. The nurse is assisting with caring for a client who will receive a unit of blood. Just before the infusion, it is most important for the nurse to check which item? 1. Vital signs. 2. Skin color. 3. Oxygen saturation. 4. Latest hematocrit level. The correct answer is 1. Vital signs. Rationale: a change in the vital signs may indicate that a transfusion reaction is occurring. The nurse assesses the client's vital signs before the procedure to obtain a baseline every 15 minutes for the first half hour after beginning the transfusion, and every half hour thereafter. Skin color, oxygen saturation, and most recent hematocrit may be checked, but are not the most important. Question 7. A client who is receiving a blood transfusion rings the call bell for the nurse. When entering the room, the nurse notes that the client is flushed, dyspneic, and complaining of generalized itching. How should the nurse correctly interpret these findings? 1. Bacteremia. 2. fluid overload. 3. Hypovolemic shock. 4. Transfusion reaction. The correct answer is 4. Transfusion reaction. Rationale. The signs and symptoms exhibited by the client are consistent with a transfusion reaction. With bacteremia, the client would have a fever, which is not part of the clinical picture presented. With fluid overload, the client would have crackles in addition to dyspnea. There is no correlation between the signs mentioned in the question and hypovolemic shock. The signs identified in the question are indicative of an allergic reaction, which is one type of blood transfusion reaction. Question 8. A client who is receiving a blood transfusion has experienced a transfusion reaction. The nurse sends a blood bag that was used for the client to which area? 1. The pharmacy. 2. The laboratory. 3. The blood bank. 4. The nursing cart. The correct answer is 3. The blood bank. Rationale. The nurse prepares to return the blood transfusion bag containing any remaining blood to the blood bank. This allows the blood bank to complete any follow-up testing procedures that are needed after a transfusion reaction has been documented. The remaining options are incorrect. Question 9. The nurse takes a client's temperature before giving a blood transfusion. The temperature is 100 degrees Fahrenheit orally. The nurse reports the finding to the charge nurse and anticipates that which action will take place. 1. The transfusion will begin as prescribed. 2. The blood will be held and the healthcare provider will be notified. 3. The transfusion will begin after the administration of an antihistamine. 4. The transfusion will begin after the administration of 650 milligrams of acetaminophen. The correct answer is 2. The blood will be held and the healthcare provider will be notified. Rationale. If the client has a temperature of 100 degrees Fahrenheit or more, the unit of blood should be held until the healthcare provider is notified and has the opportunity to give further prescriptions. The other options are incorrect actions. Question 10. Which of these clients are most likely to develop fluid overload? Select all that apply. 1. A premature infant. 2. A 101-year-old man. 3. A client on renal dialysis. 4. A client with heart failure. 5. A client with diabetes mellitus. 6. A 29-year-old client with a headache. The correct answers are 1. A premature infant. 2. A 101-year-old man. 3. A client on renal dialysis. And 4. A client with heart failure. Rationale. Clients with cardiac, respiratory, renal, or liver diseases in older and very young clients cannot tolerate an excessive fluid volume. The risk of fluid overload exists with these clients. Question 11. A client has a prescription to receive 1,000 milliliters of 5% dextrose in 0.45% sodium chloride. After gathering the appropriate equipment, the nurse takes which action first before spiking the IV bag with the tubing? 1. Uncaps the distal end of the tubing. 2. Uncaps the spike portion of the tubing. 3. Opens a roller clamp on the IV tubing. 4. Closes a roller clamp on the IV tubing. The correct answer is 4. Closes the roller clamp on the IV tubing. Rationale. The nurse should first clamp the tubing to prevent the solution from running freely through the tubing after it is attached to the IV bag. The nurse should next uncap the proximal portion of the tubing and attach it to the IV bag. The IV bag is elevated and the roller clamp is then opened slowly, and the fluid is allowed to flow through the tubing in a controlled fashion to prevent air from remaining in parts of the tubing. Question 12. The nurse is doing a routine assessment of a client's peripheral intravenous site. The nurse notes that the site is cool, pale, and swollen, and that the IV has stopped running. The nurse determines that which has probably occurred. 1. Phlebitis. 2. Infection. 3. Infiltration. 4. Thrombosis. The correct answer is 3. Infiltration. Rationale. An infiltrated IV is one that is dislodged from the vein and is lying in subcutaneous tissue. The pallor, coolness, and swelling are the result of IV fluid being deposited into the subcutaneous tissue. When the pressure in the tissues exceeds the pressure in the tubing, the flow of the IV solution will stop. The other three options identify complications that are likely to be accompanied by warmth at the site rather than coolness. Question 13. The nurse is assigned to care for a client with a peripheral intravenous infusion. The nurse is providing hygiene care to the client and should avoid which while changing the client hospital gown? 1. Using a hospital gown with snaps at the sleeves. 2. Disconnecting the IV tubing from the catheter in the vein. 3. Checking the IV flow rate immediately after changing the hospital gown. 4. Putting the bag and tubing through the sleeve, followed by the client's arm. The correct answer is 2. Disconnecting the IV tubing from the catheter in the vein. Rationale: the tubing should not be removed from the IV catheter. With each break in the system, there is an increased chance of introducing bacteria into the system, which can lead to infection. Using gowns with snaps and inserting the IV bag and tubing through the sleeve of the gown first are appropriate. The flow rate should be checked immediately after changing the hospital gown, because the position of the roller clamp may have been affected during the change. Question 14. The nurse is making a worksheet and listing the tasks that need to be performed for assigned adult clients during the shift. The nurse writes on the plan to check the intravenous of an assigned client who is receiving fluid replacement therapy how frequently? 1. Every hour. 2. Every 3 hours. 3. Every 4 hours. 4. Every 6 hours. The correct answer is 1. Every hour. Rationale: safe nursing practice includes monitoring an IV infusion at least once per hour for an adult client. The remaining options do not provide time frames that are safe or acceptable. Question 15. The nurse is checking the insertion site of a peripheral intravenous catheter. The nurse notes the site to be reddened, warm, painful, and slightly edematous in the area of the vein proximal to the IV catheter. The nurse interprets that this is likely to result of which? 1. Phlebitis of the vein. 2. Infiltration of the IV line. 3. Hypersensitivity to the IV solution. 4. An allergic reaction to the IV catheter material. The correct answer is 1. Phlebitis of the vein. Rationale: phlebitis at an IV site results in discomfort at the site and redness, warmth, and swelling proximal to the IV catheter. The IV catheter should be removed and a new IV line should be inserted at a different site. The remaining options are incorrect. The signs and symptoms in the question are not associated with these conditions. Question 16. The nurse has been instructed to remove an intravenous line. The nurse removes a catheter by withdrawing the catheter while applying pressure to the site with which item? 1. Band-Aid. 2. Alcohol swab. 3. Betadine swab. 4. Sterile 2x2 gauze. The correct answer is 4. Sterile 2x2 gauze. Rationale: a dry, sterile dressing such as sterile 2x2 gauze is used to apply pressure to the site while the catheter is discontinued and removed. This material is absorbent, sterile, and non-irritating to the site. A Band-Aid may be used to cover the site after hemostasis has occurred. An alcohol swab or betadine would irritate the open puncture site and would not stop the blood flow. Question 17. The nurse is preparing an intravenous solution and tubing for a client who requires IV fluids. While preparing to prime the tubing drops and hits the top of the medication cart. The nurse should plan to take which action? 1. Change the IV tubing. 2. Wipe the tubing with betadine. 3. Scrub the tubing with an alcohol swab. 4. Scrub the tubing before attaching it to the IV bag. The correct answer is 1. Change the IV tubing. Rationale: the nurse should change the IV tubing. The tubing has become contaminated, and if used, it could result in a systemic infection in the client. Wiping or scrubbing the tubing is insufficient to prevent systemic infection. Question 18. A client is going to be transfused with a unit of packed red blood cells. The nurse understands that it is necessary to remain with the client for what time period after the transfusion is started? 1. 5 minutes. 2. 15 minutes. 3. 30 minutes. 4. 45 minutes. The correct answer is 2. 15 minutes. Rationale. The nurse must remain with the client for the first 15 minutes of a transfusion, which is the most likely time that a transfusion reaction will occur. This enables the nurse to detect a reaction and intervene quickly. The nurse engages in safe nursing practice by obtaining coverage for the other clients during this time. 5 minutes is too short of a time period, while 30 and 45 minutes are lengthy time periods. Question 19. The nurse is assisting with caring for a client who is receiving a unit of packed red blood cells. The nurse should tell the client that it is most important to report which sign immediately? 1. Sore throat or earache. 2. Chills, itching, or rash. 3. Unusual sleepiness or fatigue. 4. Mild discomfort at the catheter site. The correct answer is 2. Chills, itching, or rash. Rationale. The client is told to report chills, itching, or rash immediately because these could be signs of a possible transfusion reaction. Mild discomfort at the catheter site may be indicative of a problem, or it could result from the size of the IV catheter required to infuse the blood product. Sore throat, earache, sleepiness, and fatigue are unrelated to a transfusion reaction. Question 20. The nurse is assisting with caring for a client who has received a transfusion of platelets. The nurse determines that the client is benefiting most from this therapy if the client exhibits which finding? 1. An increased hematocrit level. 2. An increased hemoglobin level. 3. A decline of the temperature to normal. 4. A decrease in oozing from puncture sites and gums. The correct answer is 4. A decrease in oozing from puncture sites and gums. Rationale. Platelets are necessary for proper blood clotting. The client with insufficient platelets may exhibit frank bleeding or the oozing of blood from puncture sites, wound, and mucous membranes. The client's temperature would decline to normal after the infusion of granulocytes if those transfused cells were then instrumental in fighting infection in the body. Increased hemoglobin and hematocrit levels would be seen when the client has received a transfusion of red blood cells.
You can check out my study guides and reviews. Links will be in the description. Thank you for watching.